and the person would give me my prayer power.
Courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
BCTV, impacting through the gospel.
This program is proudly sponsored by Benbeni Travel and Consul for your passport, visa, and other genuine traveling documentation. Locate Benbeni Travel and Consul at Osufariko Mall. Contact Benbeni on 0244 362 445. Are you looking for the best engineering company for any kind of automation works like roofing and block making machines, construction and batching plants, and many more? Then FREDUA Automation is your best option. Locate us at Amasaman Ajen Kotoku. Call FREDUA Automation Limited on 050-493-9395 for all your Casapreco products, drinks, and water. Find MCO Enterprise at Tema Community 2 near Wasaman Chop Bar and Dowenya. Reach out to MCO Enterprise on 0244-324-883 for all your media works, video coverage, media setup, graphics, sound, and many more. Contact Lightest Multimedia on 054-817-9863. Are you in need of logistical services like import and export, freight management, and many more? Then contact Priest Logistics on 0246-658-161 or 0244-777-276. Priest Logistics is located at Captain House, Tema Community 5, Room 3, behind Hunch Catering Services. Kenley Company buys and sells shoes and new office chairs, kitchen set, drawers, and many more. Locate Kenley Company opposite Tema Stadium at Tema Community 1, opposite Tema Stadium, or call 0244-219-633 or 054-514-7679. Reps Household Limited. We provide cash and credit sale of all gadgets like TV sets, rice cooker, home theater, and all kind of gadgets. Contact Reps Household on 0243-817-535 or 054-609-0403 for all your kids and unisex African wears and etc. Contact eFashion and Boutique on 0244-084-240 or 0245-791-365. Locate eFashion off the Tema Community 1 Road, adjacent the police station. eFashion, home of African designs. Decovers Enterprise provides services like wedding decor, wrapping, funeral decor, floral arrangements, and many more. Locate Decovers Enterprise at Tema Community 2, opposite the post office. Contact 0244-260080 or 0243-602-2021. Decovers Enterprise. Say it all with flowers. For all occasions you require beauty services like hair washing, makeup training, wig making, hair braiding, manicure, pedicure, and many more, reach out to Crash Makeovers Beauty Parlor off the Mataheko Afienya Road. You can contact Crash Makeovers Beauty Parlor on 0548-247-845 or 053-598-9444. Crash Makeovers Beauty Parlor. Beauty beyond imagination. Do you have a dream of helping the kingdom business and sending salvation to the doorsteps of people? Abba Partners is here for you. Join Abba Partners now and together win souls for Christ. Call 0243-804-676 to be a partner now. Join Promised Land Faith Ministries International every Monday 7 p.m. to 8 p.m. for Bible study. Log on to Promised Land Faith Ministries International on Facebook to join for a divine prophetic encounter. Join our Faith Hour service every Wednesday 9 a.m. to 2 p.m. and on Friday Manifestation Half Night 7 p.m. Promised Land Faith Ministries International holds 2 services on Sunday 8 a.m. to 12 noon at Faith Temple Tema Community 1 and 6:30 p.m. at Atadeka Branch 40 Rooms Coco Junction. Remember that we bring you a 3-day power-packed conference every last weekend of the month. Friday, Dominion all night at 9 p.m. Saturday, prayer and deliverance session. Sunday, victory service. He is God. He can do all things.
Hello, good afternoon everyone, and you are welcome to our Health Talk series, Health Talk on PCTV. Today we're going to have another exciting discussion on women health. In fact, it affects both men and women, and I'm glad you've joined me today. And don't be here alone, so I kindly encourage you to share the link with others, family, friends, and everyone to join us on the call, because this topic is very crucial and very important to everyone. So this is Promise City TV, and I'd like to tell us something briefly about this channel. It's a religious channel, and so we have programs lined up throughout the week that will help build us up spiritually, mentally, and health-wise too. So that's why we always have Health Talk on Sundays. So on Mondays, we have online Bible studies starting at 7 p.m. Then on Wednesdays is Exaltation Hour with our sister Arabi. Then on Thursdays is Inspirational Hour with Pastor Jessica, where we have inspirational stories from people sharing their experiences and their encounters, which has helped them in their walk with God and walk here on earth. So you're always welcome to join us on Thursdays for that. Then from Mondays through to Friday in the mornings at 11 a.m. is Visitation Hour with our mother, Apostle Mrs. Bernice Agyeman, and she's the CEO of Promise City TV and also the General Overseer and founder of Promised Land Faith Ministries. So that's the program outline for the programs online. Then in person at Promised Land Faith Ministries, every Wednesday we have Faith Hour at the Faith Temple located at Tema Community 1 behind the Goyle Filling Station starting at 10 a.m. Then on Fridays at 9 p.m. is the Manifestation Half Night. And so you are always welcome whenever you find yourself in Tema to join us at the Faith Temple 9 p.m. on Fridays. Then on Sundays in the morning at 8 a.m. is Victory Service. And then in the evening is Victory, another service at Ashama Atadeka, that's at the Victory Temple. So you're always welcome, whether in Tema or Ashama, you are always welcome to join us in there to fellowship. Okay, and we have a special program coming up, and our mother, Apostle Mrs. Bernice Agyeman, is going to be hosted by Prophetess O.T. Linda, and the conference is dubbed Emergency Call. It's starting on Tuesday, 10th of June through to Friday, 13th. So don't miss out. It will be online as well, but if you can be there in person, please do well to be there and you shall be blessed. Okay, so I believe by now you might have shared the link with others to join us, and as I said, we're having a very important discussion today, and it's one of the requests by a viewer a couple of weeks ago when we had discussion on early pregnancy health care, and she requested that we have a discussion on in vitro fertilization, which most of us know as the IVF. So yes, today we're going to go down into the nitty-gritties of that, and I am honored to have an expert in that field with me in the studios today. So he will tell us everything about it, anything that you need to know. And if you have any questions, any concerns, you can drop it right there in the comment section, and I'll read it out to him, and then he will address it for us. So IVF is a common thing. It's one thing that most people have considered, and it has become an option where it brings hope to people who have fertility issues. So it's a concern for both males and females. So let's go right in as you help me welcome Mr. Nana FREDUA AGYEMAN.
Right, thank you.
Nana, you're welcome. Thank you for accepting this invitation and joining me here in the studios.
Thank you
so
for
much.
inviting me over. Thank you.
Great. Okay, so we'll go right into the discussion. We've been hearing IVF. For someone doesn't even know that IVF is in vitro fertilization. So to get started, basically, what is IVF?
All right, thank you very much. So IVF is one aspect of assisted reproductive technology. So they are means of getting a couple pregnant through not the natural way. So basically, IVF means in vitro fertilization. And the word in vitro in science means outside the human body.
Okay.
So it means fertilization of gametes outside the human body, because in the natural, we know the sperm has to travel to the fallopian tube, into the ampullaric ischemic region of the fallopian tube, where the eggs are released and the sperm meet, and fertilization occurs in the fallopian tube before implantation will occur in the womb. So in vitro basically means fertilization outside the human body.
The human body.
Yes.
Okay. All right. Thank you. So that clears the air. So it's not the natural way of conception.
Exactly.
Because it's happening outside the body.
Yeah.
Okay. So is this thing for everyone?
All right. So there are basically some indications that will trigger somebody to seek for in vitro fertilization.
Okay.
Some factors like advanced maternal age. Sometimes after 35, getting to 40, women basically have decreased in quality of their eggs. And also women who have their tubes blocked as a result of hydrosalpines. There are some toxic fluid which stuck into their tubes. And also women who have problems with ovulation, and polycystic ovarian syndrome, women who have cysts and other irregularities. So it's not for everybody. So if you can conceive naturally, it's not for you.
Okay. Okay.
Yeah.
So it means that there are some indications, there are reasons why.
Yeah.
So you can't just stand up and say, I'm opting for IVF.
Exactly.
You should have some of these factors.
Okay,
that
so
you've
these
mentioned.
factors basically is for the women.
For the women,
The
okay.
men too also have their side. So the men, if you are azoospermia, that means the fact that you release doesn't mean it's sperm. It's a seminal fluid, but inside the seminal fluid are sperms.
Okay.
So some men release seminal fluid but no sperm. Some men too, they've had, let's say, STIs in the past.
Okay.
And it was not well treated, so it has affected them. They had mumps whilst they are in their teen age. It can also affect them. And also, their sperm movement is very sluggish, and other factors too can contribute to IVF.
Wow.
Yeah.
This is very important, because I would have thought, or probably there's someone on the call who might have thought, that IVF is mostly for the woman when the woman has issues, fertility issues. That's where we're going for IVF. But you wouldn't think that, okay, when it has to do with the man, you can also consider going in for IVF. Okay.
Yeah,
So I think this is very important. So can you walk us through the process of going for in vitro fertilization?
All right, thank you very much. So in vitro fertilization, basically, it's embarked by the couple. It's not just so, even if the problem is from the man, the woman too must also help the man. So initial labs are done to ascertain or to diagnose where the problem is coming from. Because there are different aspects of in vitro fertilization. We have the conventional IVF, that is the natural way, or when the eggs are released from the human body, the sperms are put around for fertilization to occur. That is when the man has a very good sperm. But when the man has a poor sperm, we use something called intracytoplasmic sperm injection. That one, the sperm is picked with the help of robotics to inject into the egg. All right, so the labs are done. Initial scan of the woman is done. We see if there are no fibroids. If there are fibroids, we opt for myomectomy, like that means fibroid operation. And also, when all the initial labs are done, we also do hormonal analysis to check the hormones of both the man and the woman. If everything is fine, then if the woman is very perfect, in a perfect condition, she may use her own eggs. But the instance where the woman has advanced maternal age, or all laboratory examination shows that she has poor ovarian reserve, then the woman has to depend on a donor for the procedure to be done. So when the procedure is being done, the donor or the woman is giving some injections to help the follicles. In the natural, you release one egg in a month. But with IVF, you are stimulated to release more than one. 2, 3, 4 and above. Just in a cycle. Yes. Then through ultrasound, the eggs are taken outside and it's manipulated by the clinical embryologist. You bring the sperm together. It's formed in the lab for about 5 days and is put back into the womb of the woman, known as embryo transfer. Then after 2 weeks, lab test is done to ascertain if the woman is pregnant or not. Yes, then we take it from there.
Okay, so then it means that there's a likelihood that it could fail.
Yes, IVF success rate is between 40 to 50% for every group of women you have. So let's say you did for 10 women, the likelihood that 4 will fail or 5 will fail is high.
Wow.
Yes. So it's not 100%.
It's not 100% thing.
No, not at all.
So for couples, at what point that when they are considering conception, should they go in to see a fertility specialist?
Right. Okay, so basically what we say that the word infertility is termed as when couple have regular unprotected sex for a period of 1 year and there is no issue or there is no pregnancy. That is when they can embark on fertility treatment.
Okay.
So infertility is described as when couple have regular unprotected sex for a period of 1 year and there's still no pregnancy. And those couple can be termed as infertile and they can embark to find out what is really the problem. Sometimes it's unexplained. Scientists cannot explain why, because man is fine, woman is fine, but it's just not coming. Yeah, so it's not all of them have problems. Sometimes it's unexplained too.
Okay, with this your submission, I have 2 questions in there. So the first one has to do with when you said that for a period of 1 year, should you wait till 1 year?
All right, it depends. If some couple know their issue before they even enter into marriage.
Okay.
Yes, some have done their diagnosis prior to getting into marriage. So when they get married, as soon as possible, they embark on it. But couples who have no idea of their system, the reason why we give 1 year is that there are times when they get married, the initial stress doesn't let them get pregnant because the stress to get pregnant comes in. It puts so much stress on them and delays their pregnancy, but sometimes after 7-8 months they can get pregnant.
Okay.
So the 1 year is the limit, so
Limit
that
given,
after
okay.
all the 1 year you don't get pregnant, you embark
They
on.
can consider
Exactly.
that. Okay. So well, that being answered, then you mentioned where has this escaped me? So you talked about the 1 year period, and you mentioned sometimes it's not explained. Woman is fine, man is fine, but there's no conception. In that case, have you had instances where such couple come to you and you've tried IVF and failed?
Oh yes, so normally the unexplained, we try something called artificial insemination. Artificial insemination is different from IVF.
How different?
All right, so artificial insemination, the woman is given some medication to boost her ovulation, and the man's sperm is taken. The sperm is gotten either through masturbation or through coitus interruptus. Coitus interruptus means they have sex and they withdraw into a specimen bottle. So the man has to be very disciplined in order not to spill the samples. And the sample is washed. In IVF, we don't use raw sperm. The sample is washed to get rid of the sticky seminal fluid to get the raw, the pure sperm. So when the woman is ovulating, she comes into the hospital and the sperm is introduced into her womb to allow it to swim to where the eggs are. So quote unquote, it's just like having cohabiting with your husband. But this one, artificially, we have processed the sperm. Okay. So we can do it on 2 or 3 times. Wait for the end of the month. If you're not pregnant, try another cycle 2 or 3 times before we can consider IVF. IVF is the grand finale. It's the climax of all the fertility treatments. So there are initial ones like artificial insemination and other stuff. Sometimes medications to boost your parameters here and there, and you can even go home with your husband and you get pregnant. But when all parameters fail with unexplained, that is where we go to IVF because it's expensive compared to artificial insemination.
Artificial insemination.
Basically,
okay.
Yeah.
All right. So with that process, do you just put in one fertilizer or you put in a couple in there because of the success rate of it? With
artificial insemination. Okay, so with artificial insemination, we don't bring the eggs out.
No, I mean with the IVF.
All right. So IVF has its rules. There are some rules and regulations governing. Now the body, Fertility Society of Ghana, at first we could put in 5. You could hear that somebody has quintuplets, quadruplets, and all those stuff. We realized that most of them were losing their pregnancy along the way because multiple pregnancy has its own side effects. Most of them can't carry the pregnancy to term.
Full term.
But the goal of IVF is to carry home a healthy baby, not to lose your pregnancy at the 6-7 months. So we thought it wise that, okay, now we don't give more than 2 embryos. Yes, yeah, because multiple pregnancy results in preterm delivery, complications, preeclampsia, that means hypertension during pregnancy, fatal to mother, fatal to child.
Child as well.
So if you are 50 plus, we just put in 1.
Okay.
Because of your age.
The age.
And it also depends on how many times you have had fibroid operations. Because that means there's so many scars in
the
womb.
uterus, yeah.
And that means the expansion rate of your uterus is not as good as somebody who has no scars. So we consider all these factors before the team decide how many embryos should we give to this person. And the rest of the embryos are frozen for future.
Okay.
Yeah.
I mean, describing the process now and with hearsay, you would think IVF is quite expensive. Can you give a fair idea of?
Well, basically, IVF is expensive because almost everything that we use is imported. And so considering currency variations, the reason why. So if all the products were here, IVF
would have been less
would be very less.
expensive.
Yes, so it's quite expensive compared to those who are probably in Europe doing it there. Yeah, but so the range, it depends. So averagely, we are looking at between 60,000 Ghana cedi to, let's say, 150,000 Ghana cedi, depending
on the case.
The case,
okay.
Yeah. So everybody has his different case and how it will be approached, because there are different aspects of IVF, whether you are using your own egg, donor egg,
or donor egg, okay,
or even a surrogate mother carrying it for you because you have some complications.
So you can carry the baby.
Exactly.
Wow. Okay. And what's the accessibility and availability in the country?
Oh, currently there are a lot of IVF centers in there. Even Accra alone, we have more than 30 IVF centers.
Wow.
Within Tema, we have more than 5. Yeah. It's really accessible, but Africa and Ghanaians, we are still yet to embrace it. Because of the stigmatization. People don't want to be considered that they didn't have their kids naturally.
But who will tell? Who can tell that?
Exactly. But when people get to know, in Ghana, in Africa, this part of the world, we think if you didn't have your child naturally, God has not been faithful to you.
Jeez.
Yes. And people don't think that after probably embarking on the prayers, you have to make a conscious effort
as well.
Yeah, but they will still, so the reason why they try to hide from it. So it's difficult to let people share their success story of IVF because of the stigma.
Yeah. And I'll get it.
Yeah,
okay.
The stigma is very high.
I can imagine the emotional and social stress that comes.
Yes, the emotional, the financial stress. Yes, and also the emotional stress when it fails is very high. So sometimes clinical psychologists have to come in to help.
Assist them.
Yeah.
Wow, that's a lot. Well, if you just joined us, this is Health Talk on PCTV, and the discussion is in vitro fertilization. Most of us know it as IVF, and we have an expert here with us in the studio, and we're going into that. So if you have any questions, please feel free to drop it in the comment section. Or we just heard that sharing stories has been quite a challenge, so you don't want to share your success story there. But if you have any questions or comments, please put it in the comment section, and our doctor will be here to address that for you. Trying to see if you have any questions yet. Okay, we don't. Okay, so what happens to someone if the IVF doesn't work for the first time?
Okay, it varies from facility to facility. Some facilities have internal arrangements. If it doesn't work for the first time, sometimes there are discounts for the second time.
Okay.
Because you don't have to pay for the entire cost. Yeah, so the hospital absorbs. Some hospitals will say 50%, some will say 70%, some will even say you don't pay anything.
Okay.
So it depends on the hospital and how the arrangements are.
Is there? Yeah. Okay. And so how many cycles are needed if the first one fails?
It depends. Normally, some people can go as much as 5 cycles. Yes. So if we have probably recurrent implantation failure, we may also consider surrogacy.
Surrogacy.
Yes, surrogacy to find out where the problem is coming from. So there are some others, when it's failing multiple times, they do it simultaneously. surrogate carries, she carries. And
Wow.
whoever comes out as victorious,
Successful.
they take it, because it's still the embryos or the gametes from the husband and the egg from the wife.
From the wife.
Even if it's not, they are still the mothers.
Okay. And if both it's successful, let's say two embryos, and
Glory to God. That means you have a bumper harvest.
wow.
Exactly.
That would be good news.
Yes.
That would be
You
good
have
news.
a bumper harvest. Exactly.
Okay. Let me see if I have a question. I mean, okay, so you mentioned, this thing just came to mind, you mentioned that you have now rules governing the number of embryos you put in the womb for the woman. So what's the success rate or the chances of having triplets, twins? Is it dependent on the number you put in there?
Yes. So IVF pregnancies, normally they are fraternal twins, not monozygotic. Monozygotic is when twins are similar.
Okay.
That means when one embryo split into two. That's why you have identical twins.
Twins, yeah.
But when you put in one or two or three, and they are all implanted, they will not be monozygotic twins. They'll be triplets or twins, different. Yeah. Yes. But when you have a very quality embryo, even when you transplant or transfer one embryo, they still have a good chance of getting pregnant. Because in Europe and other parts of the world, now the goal is one embryo. They're trying to avoid multiple pregnancy at all cost.
Oh.
And we freeze the rest of the embryos. Embryos can be frozen for up to even 10-20 years.
Okay.
So if the woman finished with this pregnancy, can come back to the hospital
again
for the frozen embryos to be reused. Some people can even transfer their frozen embryos to the UK or to a different hospital, or anywhere they want to carry it to. Yes, even if it's sperm too, they can
freeze it and transport it there.
Yeah, some people too can import it.
Okay.
Yes, all of them is done. Yeah.
All right. And have you had a case where you did just one embryo and it can develop into fraternal twins? Does it ever happen with IVFs?
You mean identical twins?
Yeah.
It's very rare. It doesn't normally happen. But one embryo, one child is very common.
It's very common.
Yes.
Okay.
Hardly will you get one embryo and dividing into identical twins.
Oh.
Yes. But we have the instance, only one egg was retrieved from the woman. And one egg was developed. You know, it takes so much stress for eggs to develop outside the human body, because it's 5 days outside the human body. Even though the incubator has been designed to mimic the conditions of the womb. Yeah, but
it's very different. It's still very different.
There are times you still bring it outside and put it on your microscope. With that time, there's no incubator. They are struggling with the outside air. So the success of IVF also depends on how fast an embryologist manipulates egg or oocyte outside the human body. Because if you spend so much time, you compromise on the quality of the embryo, and the woman will not get pregnant. So every successful embryologist is a fast and accurate embryologist. Because if your embryo stay outside for 20 minutes, you're losing. Yeah, exactly.
Okay. So what's the fastest time? Not you in particular, but then what's the fastest time that one could get that work done?
It depends on how many eggs you are working on. Let's say you are working on, but thank God now they've done some media or some that can let you handle embryos outside the human body even without the conditions. So it's meant for embryologists who probably are not too fast.
Okay.
So it can compensate for all those stuff. But if you don't use, it's called MOPS. If you don't use the MOPS, that means you have to work very, very fast. And the fast is relative, but within 2 minutes, 3 minutes, you should be done with that. If you're not done, put it back in the incubator. Allow it to rest before you bring it back. Because if they stay outside for continuous period of time, you compromise on the spindle fibers. And spindle fibers if you learn molecular genetics for segregation, it doesn't let the cell divide very evenly.
Okay, and that could affect.
It could affect the cytokinesis and cell division, and finally you not get the blastocyst to transfer for the. You may have growth arrest on the 3rd day, and there's nothing for the woman to conceive.
Wow.
Not because the egg wasn't good, but it's because of your negligence and your inaccuracies.
You need someone to be very good at that.
It's very important.
Okay. touching on the gametes and it brought my mind to the gender of the baby. So then, now that it's outside, it's like under control. Can they tell, okay, I want a girl, a boy? Because you can choose the. Do you have the option to choose the gender in there?
All right, there is an option called PGD or PGT, pre-implantation genetic diagnosis or genetic test. So what we do is, on the 3rd day or on the 5th day, a biopsy of the embryo is taken. A small portion is taken to the molecular lab for them to run the chromosomal to see whether it's a male or a female. Yeah, more often it's sent outside the country.
Oh, we don't have that here.
We have some in some facilities too, yes, but we've still not gotten to the full, let's say, actualization stage. Yes, they are still at the what do you call it?
The development stage.
So most centers prefer to take it outside the country. But the moment biopsy is done, that means the embryos have to be frozen. You have to freeze the embryos for the report to come, so that you know embryo A is a male, embryo B
before you do the
implantation.
implantation.
Okay. That means the woman has to be recycled or a different, because that window is gone. You have to give
wait
the
for
woman
another
other medications, implantation medications to prepare the womb before you do the embryo transfer. It can also be used to check if the embryo has some abnormalities like sickle cell anemia,
sickle cell and those stuff,
and Klinefelter, cystic fibrosis, and all these molecular abnormalities. So in Europe and other parts of the world, without this, they don't even transfer. So it has become a routine.
A routine there as well. It's become the norm there.
But here, because of the cost involved, we try to not.
I was going to say, because that would bring an extra cost.
Extra cost is very expensive.
Allowing the woman to wait for another cycle, sending it out, getting the report.
Per embryo, most facilities outside the country, one embryo they charge about 500 euros. So let's say you are taking 10 embryos, that's like 5,000 euros.
Wow.
For the report to come before you can choose, and the freezing also comes with a cost. Freezing is not free because there's cost.
You have to create the right condition to keep the quality of
nitrogen, you need freezing media, because there are some chemicals that will have to precondition the embryo to get ready for the shock of the nitrogen. Nitrogen is very cold, negative 195 degrees Celsius. It's very cold. You can't just drop embryos inside, they'll die. So something must precondition them to resist the cold. Yeah, so all this, so the more your embryo is kept in the tank, the more your expenses also go up.
Wow.
Yeah.
This is really interesting. I believe you are enjoying and also learning. Oh, I want us to go for a quick break, and when we come back, we'll continue the discussion.
And one night, God appeared to Abimelech in a dream
and said to him, "You are as good as dead.
You are as good as dead.
Because of the woman you have taken."
Because of the woman you have taken.
She is a married woman.
She is a married woman. Hear me. This is a warning. This is a warning. The woman you have been taken is somebody's wife. And you are being a wafa. It's on your minamada yansum. Eti ya warning wa diebia enye. There was a chin who free no particular friend. Every day was Sunday here in your one home. Adam for balcon. Anytime up till now, you still you so cross Adam for him. It's when I'm in a madayasum. Say a warning. To die. Fanadia Komano. And you would hear. If you know you are holding something which is not yours, Nenyamyama won several times, that thing is not yours. Leave that man alone. Up till now, you're still holding that man. Any trap of your enemy, you fall. Oh, better form. What is a warning? What banner, what fun you'll be here? What happened?
Now Abimelech had not gone near her. So he said, "Lord,
dear Bentia, Satan na won corner ho. Satan no ni nhyia. Etinyame emma bone nto ansa no ma warning." Oh Jesus. What they come out one now when Tiana Bonina day at all. Come on, come on, come on, come on, celebrate Jesus for me.
Welcome back. This is Health Talk on Promise City TV, and today's discussion is on in vitro fertilization, IVF. And I have Nana FREDUA with me, a clinical biologist, right? Yeah, he's an expert in the field, and we've been having a wonderful discussion there. So you've not missed out much, but you can always go back and listen to what we've said so far. And so we were talking about the cost of taking it out there and the other options to IVF. You've mentioned artificial insemination. Are there any other options?
All right, we have another option called intracytoplasmic sperm injection, or we call it ICSI for short, ICSI. All right, so this procedure is basically meant for men with very poor semen count. Either their motility is very low, morphology, that means the shape of the sperm is also very poor, or the number of the sperm is very low. And also people who don't have sperm at all. There is a condition known as congenital bilateral absence of the vas deferens.
Can you break that down for us?
All right, so it's vas deferens. If you look at the anatomy of the male, it connects the epididymis to the urethra so that sperm can come. There are some people who are born without it.
Oh.
Yes, so the spermatogenesis happens, all right, but it's stuck in the testis. Nothing to bring it to the urethra. All right, so that is...
Isn't that problematic?
Yes, it's a genetic condition.
Wow.
People who have cystic fibrosis, it's a genetic condition. So those people, we have to consult a urologist who will have to do a small surgery known as testicular aspiration or microsurgical aspiration of the sperms. So they know where exactly to cut in the testis, so that they go straight into the seminiferous tubules where spermatogenesis occurs. They bring tissues out, and it comes to the IVF lab, and it's processed to get a sperm. So all these categories, when the sperm is gotten, there is a machine called an ICSI machine. It's more robotic. It's like a joystick. So it's use a needle. A needle can pick the sperm and inject it directly into the egg. All these low sperms, they don't have the ability to enter the egg.
They don't have the energy to do that.
Yes, there's something in the head of the egg called acrosome. It's a chemical that as soon as a sperm gets to the egg, it releases it so that it will lyse or create a hole for perforation for the sperm to occur. So in the natural, that is what happens. And in the conventional IVF, but with ICSI, the needle is trying to help the sperm into it. So it's released and you take the needle back. Yeah, so that is ICSI, and ICSI has a very good chance of fertilization.
Okay, because this one is hitting the nail right on the head direct.
And you know that it has entered. So most facilities in the world now, ICSI has been the standard even for a good or a bad sperm. Because
you don't want any failures.
Yes, because sometimes the sperm is looking so good. You come the following morning and they didn't fertilize.
What happened?
What happened? Very, very big question. What happened? The sperms are still swimming. You see them very active, but none of them was able to enter for fertilization. And that means the procedure has come to an end. So most centers don't want these stories. So every case is an ICSI case. Because some people have a good sperm, all right, but the sperm lacks that acrosome. But if you just did a semen analysis without doing a further analysis, you may never know you have that problem. Everywhere you go, they'll say your sperm is fantastic, but you are still not getting your wife pregnant. It's because of this problem. This acrosome problem, or sometimes because sperm DNA fragmentation. Men who like to smoke, most of them have their DNA fragmented, and they can't get the woman. So everywhere you go, they say your sperm is fine. But if they don't go to do the biochemistry, to do further investigation, they wouldn't ascertain that your sperm has an intrinsic factor. And also men who are 65 years and above, most of them have so much chromosomal abnormalities in their sperm. So they may have very fantastic sperm, but the chances of getting pregnant is not there. Even if it does, miscarriage is very high. Just with the women too, if at advanced 40 years, 40 plus, they may get pregnant all right, but they miscarry along the way because of the abnormalities
they have in there.
So ICSI is one, and there are other ones that are not so common, but there's the IVF, artificial insemination or intrauterine insemination. Some people call it intrauterine insemination. IUI.
But that's the same as...
It's basically the same.
Oh, okay.
And the IVF is when so we have conventional IVF and IVF ICSI. So they are all IVF because they are brought outside the
human body.
Exactly.
Okay. Then with the gender part which you explained, where you have to do a biopsy to check for the gender, and then before you proceed,
Exactly.
you touched on sickle cell issues. So can you have, say, couples who went ahead to marry but they are both carriers? Can they go in for this IVF option and check with their embryo to be sure that, okay, this fertilized egg is, let's say, AS or AA instead of SS?
Yes,
Do they do that?
Yes, they do that. So let's say they are all carriers of their genotype. Let's say AS or AC, SC, anything. Yeah. So when the embryos are grown, a biopsy can be done.
Okay.
To know if all the embryos, which of them is heterozygote for the sickle cell. So when the report comes, we can know that embryo A is AS, embryo B is SS. Then based on the report, you know which embryo to discard and which one to proceed. Yes, but all is a financial
thing, yeah.
But you can also have the instance all the embryos may not qualify. They may all be SS. Yeah, the report may come and say that they are all SS, or yes, it might not be favorable in your. Even though science has said 1/4.
Because I'm expecting with 1/4.
The 1/4 doesn't mean if you have 4 cases, it should be 1. It can be any. It's randomly. It's a random procedure.
Even with the IVF, I was expecting a more.
Yes, it's a random. So it will be very, very, very bad for a hospital to go ahead with IVF for a couple with these genotypes without doing PGT, pre-implantation genetic testing.
Okay.
And just go ahead and transfer and hoping the baby will not be
you wouldn't recommend
it's
that.
very, very unprofessional. It's either you don't do it at all, yes, and you just ignore it. I know some centers in South Africa where they do for HIV patients, yeah. But you must have a separate lab for
that,
HIV,
yeah.
so that
you don't
cause
contamination
Yeah,
as well.
exactly.
Okay. I mean, when you said that it's possible and with the chances, I was nearly going to jubilate. Oh my God, this is good news for some people. But I think it's still hope. There's still hope in there for them.
Yes.
If you have the money to go in for that,
There's hope.
and you can have healthy children.
Yes.
Oh, this is good news. I still take it as good news.
Yeah.
All right, so let me see if I have any questions in my comments. Okay, no questions yet. I like the way the discussion has gone so far. I have personally learned a lot. So are there risks or side effects
Yes, there are
that comes
risks.
with IVF?
Yes, there are risks of IVF. One particular risk is called ovarian hyperstimulation syndrome.
Doc, you have to be breaking down your text.
All right, so we know in the physiology, the hypothalamus is a part of the brain.
Yeah.
It synthesizes a hormone called gonadotropin releasing hormone, and this hormone acts on the pituitary gland, and the pituitary gland also produces the gonadotropin, which is the follicle stimulating hormone, and the luteinizing hormone, the LH. Yes, they act on the ovaries for the eggs to come. But when IVF is about to be done, an injection is given to block that part of the brain that does that work, so that artificially we can induce you with our artificial hormones. But
Why? Why do you need to do that?
if you don't do that, there'll be a flare-up. Flare-up means your body is already giving hormones,
The hormone
and you're also giving
injecting.
hormones. Hormones has their values. It will escalate,
Okay.
and it will be too much. Yes, but there are some women, after you've given them injections for their follicles for their eggs to come, they react to that synthetic drugs, and which is symbolized by the abdomen get bloated because of ascites, fluid accumulation. Yes, and in there we call something the porch of Douglas. It's a portion in your pelvis. Fluids can be there, and it's somehow not comfortable. It can be dangerous, can even be fatal, but it's well managed by most centers with the help of albumin, fresh frozen albumin and other stuff, and sometimes they have to do paracentesis. They can perforate your ovaries to siphon the excess fluid and to make you okay. That is one of the so women who have polycystic ovarian syndrome, they are likely to undergo this condition, hyperstimulation. And also we call something ovarian torsion. It's because your ovaries will be manipulated several times, so it can twist. And ovarian torsion, surgery has to be done so that at least either they cut that ovary off. And ectopic pregnancy too is possible. Sometimes when the embryo is being put in the womb, it can accidentally enter the tubes.
The tubes.
Yeah, because it's a catheter that is being used.
Oh, okay.
And if, let's say, the person didn't do it under ultrasound, and
I was going to ask about imaging to see
Yes.
into the woman.
if it's not done under ultrasound, you may think you are in the womb, but you have bypassed.
You've gone beyond the womb.
Yeah, you can have ectopic, and sometimes bleeding can occur during the egg collection. A needle is used that has to go into you in and out, and an accident can happen. An intestine can be perforated, anything.
Yeah.
Yes, a vein or something, because sometimes the follicles resemble, or a vessel may resemble a follicle, unless you use the Doppler effect to really ascertain
see.
which one is a vessel, which one is a follicle, so that you don't accidentally puncture a vessel. And some people have other side effects like blood clotting factor, so most of them are given aspirin.
Okay.
Soluble aspirin, which is an anticoagulant, so that they don't have these coagulation issues. So basically, this is some of the side effects
in there.
of especially it's always the women who suffer most, because most of the work are done on them.
On them.
If a man has a good sperm, he's done. He's just sitting home, waiting.
Please don't sit at home. Join the woman.
Waiting for the day the egg will be taken, and he'll probably. And some men even will come and just release their sperm, freeze it, and just travel. So that anything, when the woman is ready, we use it on her. Yeah, so all the injections, there are a lot of injections the person has to endure during the process. And
your body is reacting to these
exactly, like
drugs.
the progesterone injections, you can take it for 3 months. It's an oil-based injection, and pushing an oil-based injection is quite painful, like the one like the water-based. You take it for 3 months before we allow the body to continue.
Wow.
Yeah.
Now, when you touched on the imaging aspects, I'm particular there because I'm into imaging as well. So, and you mentioned earlier too about standards that now you just don't put more than 2 or 3 embryos in there. Shouldn't it be part of your standards now that the insertion should be done under imaging?
Yeah, you are right. It should be, but most of the doctors were trained because something. The clinical touch. It was the first aspect of IVF. It was done IVF doing embryo transfer without the ultrasound.
Yeah.
And most of the literature compare the results, and the difference is not that much. Whether you use ultrasound or not. But majority of the gynaes or the doctors are really trained for that. So the margin of errors are not as much as.
Oh, okay.
And for embryo transfer with ultrasound, it's a lot of work. A nurse has always to be there, has to position the abdominal probe perfectly to get. But in Europe, it's the standard.
Okay.
But here, I can't say the standard. I've not been to other hospitals
to see what's going on there.
It's the standard, but I know some people, most earlier gynaes who learned under the pioneers of IVF.
I mean, there's been a lot of technological advancements. So before ultrasound and imaging, it was done as you're saying.
Yeah. So, but still, most of them still prefer to do it at the blind side. But the new and upcoming gynaes also prefer the ultrasound.
To do the image guided
insemination.
Okay, exactly. That's fine. So with most of the things, there's risks that you've talked about pertains to the mother. What of the baby?
All right. So the baby, one of the risks is the preterm delivery, which is one of the risk of IVF. Most of the babies are delivered preterm, especially when you have multiples. And also because of the cost involved in the treatment, anytime the doctors see there is something or there's there's probably abnormal contractions and other stuff, they prefer to take the baby to save the baby.
To save the baby down.
Yes, exactly. And so that is the risk. And others also say that sometimes there are abnormalities in the babies, but my center, for instance, I'm yet to see some, because majority of the work also depends on the embryologist. If an embryologist cannot identify, for you to identify the fertilized egg, you have to see 2 nucleus or pronuclei inside. But in case it's 3, but accidentally you couldn't see it because one was superimposed on the other, you may transfer the embryo, and that embryo you transfer will have more than 46 chromosomes. Definitely, yes, it may have
some abnormalities.
But just as the natural has abnormalities, the artificial too probably have abnormalities.
Okay. Sure. I don't know if we touched on this, but then someone's asking me privately that how long does the entire IVF process take?
It's relative. If you came and you don't have any conditions that will interfere with the IVF, let's say you have fibroids, we are now going to do myomectomy, you have to wait for about 3 months for you to heal for the procedure. So all things being equal, if everything is fine, if you are using your own eggs, it's your husband's sperm, you need about 2 months, because the first month will be for the labs and other things, and then to check your ovarian reserve. Then probably the second month is for you to take the injections. The injection takes about 10 days.
Okay.
Then the trigger is given. A trigger is to mature the eggs, and after 36 hours the eggs are taken. So we have about 2 to 3 months. The procedure should be done. Unless maybe you are using a donor egg. That is where the hospital has to seek an agency to bring a donor based on your specification. And the donor's menstrual cycle and your menstrual cycle will be synchronized using what do you call it? Contraceptive pills.
Wow.
Yes, it's pills will be given to you. You'll do some calculation, because if your menses don't synchronize, the phases of your menstrual cycle will not synchronize. So when the eggs are released, you are not in the right window for you to receive it. Yeah, that's why we do the synchronization. So without synchronization, you can't get a quality result. So the eggs are released at the time you are about to have your menses. It doesn't work. Yeah, so we do synchronization, then your menses will come together. So by the time you're taking the eggs, your womb too is ready. Then we do the transfer. Yeah.
Instead of probably, let's say, freezing it and waiting for the right cycle.
Exactly.
Does that also reduce the quality of the embryo?
Sometimes. Because not all embryos can withstand freezing. There are times you can freeze 5 embryos, but when you are thawing, 2 may not survive.
Wow.
Yeah, so freezing is not the 100% option. If you can do it fresh, it's fine.
It's fine.
But if there is a circumstance beyond your control, yes, it can be frozen and later be done. Depend on the technique of the scientist or the embryologist. If the freezing technique wasn't done well, post-thaw, you wouldn't get the morphology you are expecting. Exactly.
All right. Thank you very much. I believe she's okay. So she has another one. She says, how many times can IVF be done safely? Is there a limit to how many attempts or advisable?
There's no limit. I know a client who did it for 8 times. Got pregnant on the 8th time. Yes, it takes a lot of courage for you to do it. Yes.
On the 8th child.
So there are times the team has to sit down and see if what is really happening. If the reason why you're not getting pregnant is due to probably your womb is not being so receptive and other things, we can advise that, okay, this is a situation, we think let's go for a surrogate mother, or we think the problem is this, it's a semen problem, then we advise and see the way forward, because it's a lot of money to be doing it. People have to sell their lands and other stuff, and yes, and so we always do a quality control when pregnancy fails, so that we can know where is it coming from.
Where the failure is
coming from the lab, is it coming from the client, is it coming from this. Sometimes I have to even ask them a question. Sometimes they don't even take the medications, as some people will just probably, let's say, go for a funeral, leave the medication at home. So the 12 o'clock time, they didn't take it. They come in the evening now, and it has broken
the cycle.
People don't see the signal. So sometimes through interrogation, you realize that, the person was
meticulous with their medication.
Yes, with the medications. So you have to let them get serious with them. Sometimes they get pregnant. Yeah, so you can do it as much as you can.
As much as you can.
Yeah.
Okay. This question has just come back to me. So how safe is IVF with sex? Does it interfere? So after having an IVF done, their successful implantation, can the couple go ahead with their normal sex life, or there are some controls there?
Normally we advise them not to. IVF is not, it's not natural.
Okay.
Right. Yes, you are pregnant, but it's not natural. Anything can happen, and because of the cost involved, we try to make them as secure as possible. Yeah. So after when you've gotten pregnant, you go to your house. Maybe the doctor will have to advise you how you go about it.
Okay.
Yes, how you go about your normal, especially if you're carrying more than one. Yes,
embryos.
One embryo. So you try not to mimic people who really have natural pregnancy.
Okay.
Yes, because it's artificial, though. But you have to really take care of yourself. Yeah, but we are different people. Some people are very strong. Nothing will happen.
Nothing happens to them.
Yes, but people are always concerned about the cost.
Yeah,
so
so you wouldn't want
everything
to
tamper
with it.
Exactly. So people don't really want to have sex that much, or they try to stay away from sex, especially at the early stages.
Okay.
Not to miscarry the pregnancy.
The pregnancy, okay.
Yes.
But let's say maybe the second trimester or third trimester, now
Probably
they can
do
there's
it.
still a bit of control.
It depends. If the person did cyclage. Cyclage is, if there are some people who have very weak cervix, so as soon as they get pregnant, then the pregnancy just comes out. So before they go home, the medical doctors will suture the mouth of their womb.
Okay.
So if you have a patient like that, we don't advise that you still go ahead to have sex. Yes, because of you can let the suture remove
And easily lose
abort
the baby.
the pregnancy. Yes. So some people even prefer to stay in the hospital for the entire 9 months. Yes,
Wow.
because of what they've sweat to achieve it.
Achieve it.
Nothing will go down the drain. They'll try to stay, carry their baby home, and now they are free.
Wow.
Exactly. So some people can take leave without pay from their workplace, 9 months being in the hospital, so that because 24 hours nurses and doctors are available just in case of any eventualities.
They can quickly
Yes,
come
they
to your
can
aid.
come to your aid. Exactly. So especially the francophones and other people outside the country, we have a lot of foreigners coming into the country to have this done. They prefer to stay and get everything before they go back to their country. Exactly.
Wow. This is really good to know, good information. Wow, it's already 5. We are 4 minutes into 5 p.m. Let me see. Checking to be sure I don't have any private messages again to answer. Okay, there's no question online. I guess my friend is also okay with the answers you've given her. Thank you so much. So this will bring out to us to just the last bit of it, lifestyle issues. As we've talked about the sex life, what other lifestyle issues should someone who has successfully had the IVF done consider?
As in
Lifestyle. So how do you carry yourself now? It's a successful IVF. You have the pregnancy going on. Well, we've touched on the sex aspect. So your social life, your normal work life. Some prefer to stay in the clinics, but if you're not in the clinic throughout the 9 months, how should one carry herself?
all right. So first of all, it depends on what the doctors will inform you. Some can go to their normal workplace.
Duties. Okay.
Some may be told not to drive, not to stretch, not to lift heavy stuff. Try to lift heavy luggages and stuff, especially those who have done cyclage. Aside that, you live your normal life. You can go to church, you go to your office. Some people can drive. You can do basically anything at all.
Okay.
Yeah, so it depends on what your doctor tells you, or how many babies you are carrying, and the circumstances surrounding your pregnancy that you have to really take care. Aside that, it's a normal pregnancy. You move about your normal
duties
deliveries.
without restrictions.
Yeah. Nobody might even know it's IVF pregnancy because you are working about you are pregnant. Yeah.
That's why I was concerned earlier when you mentioned the stigma that comes with it, because if I don't tell you, you wouldn't know that I went in for IVF, and there's no procedure on me that tells that I went in for IVF. So for the stigma part,
for the stigma part, another issue is that people, especially people who are very old. Let's say you know a woman who is 50
Okay,
years,
okay.
and all of a sudden you saw her pregnant.
Pregnant. So people would definitely
People
think,
would-
okay,
yes, people
she's
will
either
know
gone in for artificial
IVF
insemination
or-
or IVF.
yes, exactly.
Well, that's true.
That's one aspect people try to, and as the success story is difficult to get people. Sometimes we want to do a documentary on the success story. Nobody wants to be.
It could be an audio, not necessarily a video.
Yes, but some people can't even decode your voice.
No,
Unless
right.
we do the voice some funny way.
Yeah,
So
before
some people even do a video of the back of the person and blend it so that you can't
tell.
Yeah, but I know very soon we get there. It will be.
Gradually.
People can give testimony in the church that I got my kid through IVF. And
I mean, God gave us the wisdom for these things
Yeah.
to help us. So I don't see why I've not been there. So let me not
yeah,
be
because you
judging.
know some religious this thing
Yeah,
they
frown on
upon it.
these. Yeah.
Yeah, so people try to be circumspect sexually with IVF. They think it's not
God's
stuff.
way.
Yeah.
It
In
is
Africa
well.
especially.
Yeah, Africans, yeah.
Even we see
I
cesarean
understand.
section as not God's way. If you don't deliver through the vagina, we think God has not been faithful to you.
So even when there are complications and you could lose mother and baby or either of them.
Oh yes, people even resist it. It's because of our culture. But very very soon we will understand that
Yeah.
CS is not for the sinner. It's a way to save mother and baby.
Yeah.
And it's now even most the preferred choice by most women because they can really program it, and most of these these neonatal
Conditions, yeah, you would avoid
you
them.
avoid it. Yeah.
Well, that's true. When I was in the clinic with cancer care, we have a couple to lose their breasts and save the woman's life. The husband is like, no, don't touch the woman's breast. But
Wow.
you need to save your wife. But then it is well. It is well.
Yeah.
Thank you so much, Doc. I've really enjoyed today's discussion and learned a lot too. And I believe our viewers have also learned so much. This video is always available online, so if you just joined us, you've not missed out much. You can always go back and listen, and you can also put your questions in there. If you have any questions, I'll pull Nana FREDUA to answer them in the chats for you, so don't worry about that. And so thank you so much. Our time is fast spent and we have to wrap up for today. And so Doc, before we end, any last advice to any couple that are having fertility issues or have even tried the IVF and it's failing?
All right. So first of all, I advise a couple or would-be couple to embark on pre-marital fertility screening, so they know what they are dealing with before they get into marriage. And also, when they get married, they should be one to embark on the fertility screening or fertility treatment. And they should avoid apportioning
Blames.
even if you know it's coming from the other party, because when the two synchronize and do it, it's perfect. And I also advise couple that if you fail, don't give up. Get to the medical doctors what led to the failure, and if you can work on yourself, sometimes you have to reduce your weight, do other things, take the medication. Yes, and there's always a hope, because people who are even 60 years are going home with their babies.
Wow.
How much more young couple? So there's always a way out, but it's for you to accept the reality. Yes.
All right. Thank you so much, Doc. Before I let you go, probably there's someone on the line and wants to give that a shot, has tried it a couple of times or has been thinking of it but hasn't yet made the move, but wants, from this discussion, now wants to do it. Where can we find you? Where can we locate you?
So I work at Provita Specialist Hospital. It's at Committee 6,
Okay.
near Stella Hotel. Yes, and also close to Brobson Pharmacy.
Okay.
Yeah, that is where we work. We deal in anything fertility, anything gynecology.
All
Yeah.
right. Okay. Thank you so much, Doc.
you.
It was great having you. Thank you all for joining us today. And the discussion has been on in vitro fertilization, what most of us call the IVF. And it has been a very insightful discussion. And as I said earlier again, I'll recommend us to go back, listen and learn, and also share with others. Probably you know someone who is having fertility issues or has tried the IVF but has failed a couple of times. There's still hope. There's still hope. Don't give up yet. And this is a faith channel, so I'll say let's keep trusting God I believe God has given the knowledge to this, giving people insight, scientists insight, and have developed this technique, and it's giving a lot of hope and possibility to couples. So don't give in yet, don't give up yet. You can visit Doc at his facility Provita or any other facility you are comfortable going to and have an assessment of your fertility status. Both couples, as he said, don't go alone and don't apportion blames. Stand together as one. Said the two shall be one. So now that you are one, go in together, and I believe God will make a way. Okay, so we've come to the end of today's discussion, and before you go, I'd like to acknowledge our sponsors who have helped us to make this show run successfully. And so I have Benbeni Travel Consults, and they deal in travel documents. I keep saying this time again and again. Please, if you don't have a passport, they are a call away. Or you can visit them at Osuforiko Mall, and they will assist you to get a passport, with ease. No stress, at a very affordable fee. So call them or visit them at Osuforiko Mall, and they'll be there to assist you. We also have ABBA partners, and they are the sponsors of Your Salvation Is Now Crusade. They also sponsor this channel. If you want to be a partner of this outreach mission, you can call the numbers on your screen, and they will have a discussion with you to become a partner of this program. We also have eFashion and Boutique. eFashion and Boutique, they deal in kids and adult wear, both unisex, so male and female, any attire that you want, African designs, they would do that for you neatly and classically. They are located at Tema Committee 1, adjacent to the Committee 1 police station. We also have Lightest Media, and they will handle every media need that you have. It could be photography, videography, you need some branding, designs, anything at all, media, they are your best shots. You can call them, their numbers are on the screen, and they would assist you. We also have Hemco Enterprise, and they deal in water and drinks. She's located at Tema Committee 2 and also at Dowenya. You can call on her numbers are on the screen, and she will deliver to your doorstep. Rope Automations is into roofing, block and block making machines. It could be installation, it could be servicing, it could be maintenance. They are located at Ajin Kotoku, Amasaman, Ajin Kotoku. You can also call them. Their numbers are displayed on the screen for you. Then we have Preci Logistics. So if you have to import, export, or manage any freight for yourself, just call them, or you can also go to their office behind the Hanch Catering Service at Tema Community 2. Then we have Kenley Company. They deal in household appliances, furniture. It could be used or new furniture. Either you want to sell or you want to buy, you can call them or go to them opposite the Tema Stadium. Then we also have Reps Household. They deal in household gadgets. So if you have cash to buy, that's good. If you want to also buy on credit, you can call them and they will have the terms and conditions laid before you. You decide and have the gadgets that you need for your household. Then last but not the least is Decovas Enterprise. And they are into all kinds of decor. It could be for your office events. It could be for your wedding, engagement, anniversary, parties, you name it. She is at Tema Committee 2 opposite the post office. Her numbers are also displayed on the screen, and you can call her to attend to you. Okay, so that's it for our sponsors, and it's a wrap for today. The discussion has been on in vitro fertilization, IVF. Thank you for joining me today, and we'll see you same time next week, 4 p.m. for another episode of Health Talk. I've been your host, Abigail Quay. It's bye for now.
In the realms of the spirit, I was a bema wari lady me to my now in the realms of the spirit, as a crofobia bedomo passport up to immigration, baby as a A draw no passport and open your year and say, I want to return. Go to move to many so I didn't most soon smooth them. The nibet me one brochure, I didn't know our reaction in the two. The name on them pageant in our deal, but so smooth them. Say to me, I'm more entire immigration near sign, not pretty to Jawdea. A touch of warrior, true warrior, and the memoir quabuchi, or what the movie pija. Na many so dey mo so smooth fam transner ade who say welcome ni place we be show mo be great krofa kese fon kwa ne ba wakwan mu krofa kese fon kwa ne ba wan mu na so ntumi nyina God say kill the snake. Okay. Krofa kese fo o hye ni pe titiri on abrabom tie be say impossible pa ne panyimu a o ye obi a bibi won nsam o hye ni pa kese fo batanyana there is a woman in your house. What's a phone? Passport is the phone. Ring it us. Now me busa angel ne say passport here ring it us so there. Was it way I am acquaint you? Then move and awade. Say awade dey be two kwan. Na ma make some chero. Ma make some chero. Say nya me poa. Ah? Na wo two kwan ya. O ma enta me say bibi dey breaking don't breakable. And I'm a boy. I am stubborn. And to me, break why be to me. But I know there is a God of Mama Linda. Mama Linda said, confirm. That means to say there is a grace. I was saying, it is up to her to connect to the grace. Last 2 years, disappointments be by what now I'm repeating the same thing.
I say repeating the whole.
My God. Who believe there is a grace here?
Yes.
I didn't think I am going to grace in the Paul and Silas, they work out, they pray because some who deny Jesus Christ here, they pray to Jesus. I'm not telling you here. I'm pa a casa de momo. And say grace. That means to say this is unbreakable, but the grace upon the woman of God will break that unbreakable.
Amen.
In the realms of the spirit, men who say so can see a top. Men who say we generous anymore. To say a choir yes a quanta 9 years. Nim fin Johnson in fin. Men who say woo super. Men who say woo super. Men who say woo super. But men who say obi edu ha na wetwam. 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 Na musa brante bi show say. No no so twa na me busa angel ne say. Ada brante na dru ho na asa o gya no so atwa me. Was when ni brante ni betu kwa but sunsun no. Ma me kro tefam no. No son o gya ho say. E no say atwa.
Jesus.
Jehoshua no say atwa.
Jesus.
Spiritual.
O susa o gya ho say no say atwa.